All right, well, welcome everyone. My name is Finny Kuruvilla, and I'm one of the portfolio managers at Eventide, and this is our third talk as we assess coronavirus and its implications for us as a community, both from a health perspective as well as an investing perspective. Just as a reminder, there's going to be a lot of forward-looking statements here. There's no guarantee that any of these statements will come to pass. So with that, let's jump on in. This graphic here shows how some of us felt when we first started working at home. A lot of us, I assume, here on the call are working at home. We were pumped. We were ready to go for the long haul. And I've talked to a lot of people that by day 5 were feeling sluggish, new routines, not looking so great, ungroomed. It's been challenging for a lot of us to move in these new routines. My hope from this talk is that we'll all be a little more excited and pumped to look like day 1 there and to respond wisely to the challenges that all of us are facing. I also want to make a suggestion. As you all probably know, the Olympics were canceled for this year. They were deferred to 2021. My suggestion is that we award those medals that the Olympics was going to issue to all of the great workers that are working tirelessly all around America. This includes nurses, doctors, grocers, delivery people, postmen, policemen, firemen, and I think we owe an incredible debt to all these individuals who don't get to work at home and who are putting themselves in danger for the benefit of the broader community. So just as a review, this is my only review slide here. I've mentioned this on our previous talks that there have been 3 coronaviruses of significance. The first one was called SARS. That was from 2002-2003. SARS is severe acute respiratory syndrome. And then the second one was MERS, the Middle East respiratory syndrome. This one, not surprisingly, arose from the Middle East and associated with camels. And then finally SARS-CoV-2, which is the same name, except now it's number 2 of the coronaviruses, which is the virus that we are facing that causes COVID-19. COVID-19 is coronavirus disease-2019. I usually say SARS-CoV-2. I'll probably do that on this talk here. But those are the 3 most important coronaviruses that have impacted history. This is as of this morning, the case count here. We're almost at 1 million cases globally, 50,000 deaths. In the US, we're almost at 250,000 cases and a little bit over 5,000 deaths. So significant increases since the last call that I did just a couple of weeks ago. This is the trajectory of new cases in the United States. And I think you can see and appreciate here that cases continue to grow. They have not yet flattened or certainly not declined. And based on a lot of the good modeling that people have done, and you'll see examples of this later on, the best estimates is that this is not going to peak until late April or possibly even into May. We can look at some other countries though and get a little bit of a sneak preview into how we might fare. This is looking at new cases in Spain, and there it has leveled off a bit. Not quite the same level of increases that we've had. They've had fairly strict lockdowns there in Spain. And then we look at Italy. Italy was one of the hardest hit nations, and we can see that Italy looks decidedly on the decline, which is very encouraging. Italy started off in a somewhat disorganized manner, but then the government really put down a heavy hand, and it's worked. The social distancing, all of the measures that we have talked about here on this call and everyone appreciates are kicking in, and so this is encouraging, and this is something that we can hopefully look forward to in a few weeks when our cases also start to bend down. Germany, another European country, not too far from Italy, here also encouraging. Certainly not looking like it's increasing. Probably flat is the right adjective to use for Germany. Sweden is a very interesting country. The government there has actually said that they don't want to issue the same kind of lockdowns and heavy restrictions there. The restaurants continue to be open, the businesses continue to be open, and they're simply putting a lot of trust in their citizens, saying try to do the right thing. As you can see, perhaps not surprisingly, they're on the increase and likely will continue to increase because it's just a much more loose, laissez-faire situation there in Sweden. South Korea, I've shown this before, is one of the examples of countries that has really done a great job at testing and quarantine and using high-tech approaches to handle SARS-CoV-2. And you can see here that they had their run-up, and they had their run-up, and then they've really done a great job here. Now a very modest number of daily cases, and they continue to get quite strong there. They're not in lockdown mode. This has been very encouraging to see. There's other East Asian examples that we can look at and we should look at as well. Fairly small, in one case country, another case technically part of China, which is Hong Kong here, shown on the left, and then Singapore shown on the right. Both have populations of in the 6 to 7 million range. And they have also done just outstanding jobs at handling SARS-CoV-2. So to illustrate this, the total number of deaths that Hong Kong has experienced since COVID-19 has hit is 4. They've had a grand total of 4 deaths in all of these months there, which is all the more impressive given their proximity to China. And Singapore similarly has had 4 deaths since this has struck their island there. So very remarkable examples here. And on a per capita adjusted basis, some of the best countries there, South Korea, Hong Kong, Singapore, in terms of being able to contain this, and certainly have fared much, much better than the Western European countries as well as the US. So why the disparity in cases and fatalities? This is so striking when you look at this. When you see countries that are closer in terms of proximity, they get more flights in from China, where it all began. Why the disparity there? Well, I'm going to introduce this in a couple of ways. There's a couple of reasons for this. The first reason is illustrated nicely by this article here that came out just yesterday. It says 44 Texas students have coronavirus after spring break trip. So in March 14th, just a couple weeks ago, 70 college students from University of Texas at Austin went on a 5-day spring break trip together to Mexico, and 44 of them got SARS-CoV-2. So 44 out of 70, so a very high percentage. And here's a quote from the article. The defiant attitude at a time when millions of Americans were hunkered down at home and staying away from school, work, and relatives was embodied by Brady Sluter, a young man on spring break in Miami who declared from a packed beach, if I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying. Mr. Sluter, whose television interview was shared widely, later apologized on Instagram. So I have seen this myself. I'm in Massachusetts right now, and Governor Baker, who's the governor here in our state, issued a pretty strong restriction saying he didn't want restaurants open. He didn't want people sitting down, eating meals in the restaurant. You could do takeout, but not sit down meals. And very clear on that. And I walked around the area of town here where there's a lot of restaurants, and they were open days after he issued that warning. People were there and they're laughing, having a grand old time. People, frankly, here just have not done that well at obeying. At least some people have not done that well at obeying the government restrictions. So in general, this is a big problem, because when you don't have everyone cooperating together, you're kind of in no man's land. In order for this to work, you need a concerted, coordinated, unified response across populations, across states, across ethnic groups, ages, you name it, in order for this to work. And in general, we've not done well with that. We're more decentralized, obviously, compared to some of these other countries, but nonetheless, this has been a big factor. To do this right, what we need, and again, South Korea, Singapore, places like that have shown that we need something more like this. And it's been called the hammer and dance by someone named Tomas Pueyo. And it's a phrase I like a lot. So the black line is if you do nothing, you get the exponential growth in cases. And really what a lot of us in the West have done is something more like mitigation, which is kind of this halfway do it. There's not a lot of threat of punishment or clear consequence if you disobey the government's recommendation there. It does help a little bit, but it's not a game changer. In order to have the game changer, you need the hammer. You need everybody to really stay down at home. You need everyone to hunker down, to truly obey the government's recommendations here. And what that hammer does is it gives you time. It buys very valuable time to do some of the things that are depicted on this figure here. You can learn. You got to learn about this virus. What are we fighting here? You cut the growth. You understand who's really got it as you implement testing and tracing. You recruit personnel. You figure out treatments. You can release some of the system pressure on the healthcare hospital networks. You can build out capacity. You can do all these kinds of things in those first couple of months while you're dropping the hammer. And then eventually the dance is where you begin to let go. You start to remove most of these restrictions. You still don't have a lot of the large gatherings, but what you do in that is you've now learned a lot, and you can test, you can trace contacts, you can quarantine, you can keep R naught. That's the number of people that you infect on average if you have the disease below 1. Tighten up when you need to, but this is the basic pattern that has succeeded now in at least 3 to 4 countries, primarily in East Asia. So we need to implement this. This is an interesting picture. This is a not atypical picture that you will find in East Asian countries, where to enter into a building, there will be people that are stationed. Here you can see a man and a woman with something that is scanning the person's forehead. They're actually taking their temperature. And they just accept, as part of what it is to be part of the society, that you're going to get scanned a lot. You're going to have thermal cameras. You're going to have people taking your temperatures in order to function as a society. I listened to a great interview from one of the leaders of the effort in Singapore, and he said that, yeah, people see this in some ways as a small loss of freedom, but they're gaining much more freedom as a result, because Singapore is not in lockdown. The businesses are open. Society continues to function. And so they see that as a good trade-off. Now, I realize most of us probably don't have anything like this in our businesses here in the US. There's people don't like when they're being scanned, and they're worried about privacy. But you have to ask the question, at least, is this in fact something that, for this greater good and for more freedoms, is potentially worth it? So I think there's a whole conversation to be had here around some of these questions of privacy and public health as relates to viral spread. I also want to talk about quarantine in the Bible. I've been a little bit disturbed and sad to see some articles in various news outlets of various pastors, some in mega churches, saying we're still going to meet and we're still going to have services, and this is how we're going to show our faith in God, and the virus isn't going to touch us, and they cite Psalm 91 or something like that. In fact, that's just a very poor reading of Scripture. So in the Old Testament, in the Torah, there's, especially in the book of Leviticus, there was a strong emphasis on quarantine and washing if you were sick. I taught a course a number of years ago to the Harvard undergraduates that was a course on microbiology and human history. It was a very enjoyable class to teach, because you find that in many of the major epidemics that killed many more people than what we're facing right now, what actually turned it around was leaders in the church saying, you know what, we need to follow what we read in books like Leviticus and implement quarantine and washing. And so this is an easy conclusion, I think, that to say that it is biblically more faithful to quarantine rather than to show, quote, faith by risking yours and others' health. That is simply unbelief according to God's ways. And so those of us who call ourselves Christian or faith-based ought to consider this very seriously, that this is a clear biblical paradigm that we ought to follow. All right, let's talk about masks next. So this is the famous N95 mask that you've heard a lot about in the news. It's made by 3M, a publicly traded company based in Minnesota. And this mask is called the N95 because it, by spec, has to filter out 95% of the very small particles, like less than a micron in size. So this is extremely valuable in certain settings, particularly in healthcare settings. And there's a lot of questions around masks. Do you wear them? Do you not wear them? Should you wear them? And if you do wear them, is it more to help the person not get sick from other people, or is it to not spread infections if you already are sick, right? So I'm going to try to tackle that here in the next couple of slides. There's a lot of jokes about masks here. Here's a cartoon on the left, a lady being robbed by someone at gunpoint in a bank, and she says, "This is so wrong, a hospital needs that mask." And on the right, we see the famous Van Gogh screen painting, but reimagined with the mask. So let's tackle this here. Many people, in fact, many significant people in authority have said no to masks. So here's the US Surgeon General who says, seriously, people, stop buying masks, all caps, exclamation point. They are not effective in preventing general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. Various authorities in the CDC, the WHO have made similar comments there, so he's not an outlier here. So what's the deal? Now, just like most in the West have said no to masks, in East Asia, they have said yes to masks. This is that photograph I showed last time. This is from South Korea. This is a picture of spectators watching a figure skating competition. So very different response here. And so what is the right answer? So in East Asia, they've clearly said yes. In the West, we've generally said no. The actual science, though, says yes. And so this is a very important article. This came out of Emory University in Atlanta, Georgia, as well as a research group in the Netherlands. And they did a very simple study, which is comparing several different masks and analyzing the implications for respiratory infections. And the title gives it away: professional and homemade face masks reduce exposure to respiratory infections among the general population. So I'm going to show you here the key result of the paper. And this is really, really important for everyone to understand here about masks and what the science actually says. Okay, so let's go a little bit slowly here through this and make sure we all understand it. So let's first consider on the left, protecting yourself. So in red here is shown a sick person who's got droplets coming out of his or her mouth that are filled with SARS-CoV-2. And we're asking the question, the paper, I should say, asks the question, how many of those particles, out of 100 particles, how many penetrate through the mask to come into your nasopharynx area, your mouth area? And they compare a homemade mask to a surgical mask to the famous N95 or FFP2, which is what you'll sometimes see it called as well. So the answer is that a homemade mask reduces those particles by about 70%. A surgical mask, which is not as tight-fitting and as engineered as the N95, reduces 75%, and the N95, not surprisingly, reduces it by 99%. So what we're seeing here is, in fact, even these lesser quality, simpler masks help a lot. And this is a big deal. So you might say, oh, what does 70% mean? 70% means a lot. This is not an all or nothing proposition. The fewer particles, the lower that transmission rate, that R naught that is passed through. And so masks do, even the homemade masks do reduce particles that come in from the outside world into your nasopharynx and mouth area. And then now let's look at the right. What about protecting others? So this is looking specifically at particles produced by coughing. Now, coughing is a very high velocity force here that is delivering particles to the outside world. And as you can see, these masks do a much worse job at keeping particles behind the mask. So you can see the homemade masks, 90% of those 100 particles go out into the environment, 50% from the surgical mask, and even the N95 doesn't do that great with keeping sick particles out of the air. Only 30% are released into the environment. So the conclusion of this incredibly important study is that when you wear a mask, you're actually protecting yourself more than you're protecting others, particularly if you have a cough. Now, you're still protecting people on the outside, but really you should think about it as more of an inward protection there. However, that is a societal protection as well, because if you don't get sick, you're not going to get somebody else sick. And so in the end, it doesn't really matter that much. But the bottom line here is that masks do help. And of course, this is common sense. I want to further elaborate on this point here by showing you a stylized picture of SARS-CoV-2. And the way that SARS-CoV-2 gets into our body, it has what's called a receptor here shown in blue. It's like a docking station. And it locks into this docking station, which the formal name is called ACE2, or angiotensin converting enzyme 2. And so ACE2 is the key receptor, it's the key docking station. If the virus doesn't have that, it can't get into you. So we should ask the question, where is this ACE2 protein even on our bodies? And some people thought it might be in the deep parts of the lungs, and there is some there. However, the highest parts of where ACE2 resides, this docking site, is actually in your nose, in your nasopharynx. And so that's actually paradoxically good news, because it means that the large particles that can be blocked by homemade masks and surgical masks, those are the ones that get blocked by those types of masks, and those are the ones that go into your nose. It's the really small, fine particles, the aerosol-sized particles that go into the deeper structures of your lung, that the homemade masks and the surgical masks don't do that well on. But the good news is that the homemade masks, because they can block these larger particles, don't allow the particles to get into your nasopharynx area where this ACE2 docking site resides. So this is a really, really great insight that just has come out very recently in the scientific literature that helps explain a lot. Some of you have been reading in the news that some patients lose their sense of smell when they're infected by this virus, by SARS-CoV-2, and that makes perfect sense now that we understand where this docking site is. It's right there in the upper part of your airway. So just on masks, and I have a couple more slides, and then we're gonna transition to Dolores Bamford here, but masks, even homemade masks, almost certainly confer a benefit. The benefit is mostly to protect the mask wearer. So whoever wears it is gonna get a benefit from that. But that still helps society a lot. Masks, interestingly, might explain why East Asia has done much better at containing the disease. Now I'm gonna make a comment here. I know, hey, I'm born and raised in the US, and I know there's a stigma around masks. I remember the first time I saw people wearing masks, you think like, that's weird. It kind of looks strange. It looks a little dorky. It maybe feels like you're associating with disease, and it's usually done by people who are foreigners, and it just looks strange, right? I get it. I totally get it. But that stigma is something that actually might be hurting the West quite a bit. By the cultural norms, the same mask in, say, East Asia is perceived as, hey, you're showing social consideration. It's like you're saying please and thank you. You're a good member of society that's helping out, and you're helping out everybody here. I would urge us to think a little bit more open-mindedly about masks and try to take away that stigma. Again, I know those stigmas are powerful. Sometimes I'll see someone, broad daylight, sunny day, an East Asian lady carrying an umbrella walking down the street to shield herself from the sun. And again, like most Americans look at that and we think like, that's weird. Why would you do that? There's a lot of stigmas around these particular behaviors, but in the end, here we're talking not about having dark skin, but we're talking about preventing disease and serious harm from transmitting through the population. The key is that masks should not cause complacency. They rather should serve as an additional weapon to reduce transmission. You got to keep washing your hands and keep your hands away from your face. So some people, when they're wearing a mask, they might want to fiddle with it and get their hands up at their face, which is a bad idea. My prediction is that the CDC is going to change their recommendations, and that in the next couple of weeks, we're going to see a sea change in how at least recommendations are issued. Now, whether or not people in America follow that is another story, but I think it's going to happen. And obviously, we have to continue practicing social distancing. Masks don't replace any of that. And if you make a homemade mask, which I know is starting to get popular on the internet, make sure you launder it regularly. So the bottom line is, I would urge you to strongly consider wearing a mask within an enclosed space. If you're outside, you don't need to do it, but if you have to go into a tight space, a small store, certainly an airplane, something like that, that would be the recommendation. All right, a couple more topics here. How are we doing with testing in the United States? So testing is something I touched on in part 2. We were lagging in terms of total number of tests performed. That's all this graph shows. I made this graph from that website I talked about last time, covidtracking.com. And as you can see, we've stalled out a little bit. 100,000 is respectable. I'd love to see us get over 200,000 in terms of tests performed. So we're doing okay, but we still have a lot of room to improve there to get through what we need to. I talked to a lot of people, former colleagues from the healthcare world, and they're still saying that tests are hard to get, even for healthcare workers. So we need to amp this up quite a bit there. But trends are moving in the right direction generally, even though a little bit of a pause in the last few days. What about medical therapies? We've gotten a number of questions where you all have written in, which we really appreciate, asking our views on various therapies. So we're going to talk about that now. Hydroxychloroquine is probably the most famous. This is a drug that was approved for malaria many years ago, and the FDA issued an emergency approval for COVID-19. This is promising, but it's early. We need to run 1 or 2 good clinical trials here in randomized settings where we're going to learn a lot more. And so probably by the end of April, we're going to be a lot smarter about this. It is promising. Certainly the early data from in vitro studies, as well as some French studies and even some Chinese studies, are encouraging, but it's small data, and we got to replicate this. There's a lot of people that are working to do this, and I think we all ought to be hoping and rooting for hydroxychloroquine here as something that's going to really help those who are already infected, potentially even as a prophylactic. There's other oral therapies for COVID-19 or SARS-CoV-2. A few promising ideas, also early, a little bit behind hydroxychloroquine, particularly with respect to manufacturing. The nice thing about hydroxychloroquine is that there's lots of companies that can make very large numbers of tablets. These other therapies are a bit behind that, and so we're going to know more by June on the utility of some of those as trials are run and as manufacturing scales up. Antibodies against SARS-CoV-2. So it's a simple idea. You take people who already have had the disease, you take their blood and you figure out what the antibodies are that are attacking the SARS-CoV-2 virus, and you figure out how to make those antibodies in a synthetic way in a large reactor. And then you can use that to treat those already infected. It's not really practical to use it as a prophylactic. Probably not available until the end of summer, and probably not for general use because it is very expensive to make antibodies. It's much more difficult than making a pill, and these are injections. And then vaccines. So we've got a lot of questions about vaccines. So it is unlikely that we're going to have anything until the second half of next year, 2021 at the earliest. It just takes a long time to do these studies, to statistically power them, to figure out if they're working, to figure out if they're safe. At this point, we should temper our expectations. There's a lot of unknowns on even if a vaccine will work. No one has ever made a vaccine against a coronavirus before successfully. So certain viruses are very easily able to be vaccinated against. So for example, measles or diphtheria, those are very straightforward. Other vaccines, HIV, I mean, people have tried for 20 years to make a vaccine against HIV and had failure after failure. We just don't know enough yet about this virus to know how amenable it will be to a vaccine. On the slightly bright side is that more than 30 companies, last I checked, 35 companies are attempting to develop another vaccine, or a vaccine, I should say. So we do have a lot of shots on goal. A lot of different approaches are being tried there, but I don't think we should rely on this as our base case or something that we put a lot of hope in. We know, as I've shown you before here on this presentation, that the therapies and treatments and modalities that we have today can dramatically reduce transmission rate and bring this under control. That ought to be our base case. As you know, I've been, I think, one of the only, or at least one of the very few, to be asking questions about the root cause here. There's broad consensus. I think basically everybody agrees that this virus came in through animals in that market in Wuhan. This is so important. One of the things that we talk about at Eventide a lot is the supply chain. And supply chains are things that we don't like to think about enough. And I have to say that this is something that we need to think, particularly now, a lot more about this. Hey, people want to buy their $3 t-shirts from Walmart and their $5 rotisserie chickens from Costco. But what is the true cost there? When we buy the cheap clothes from Walmart that came from a very unsafe garment factory in Bangladesh, there's costs there that aren't necessarily obvious when you purchase that good. Our insatiable desire for large amounts of cheap meat and other such exotic meats has been very, very damaging here. This is just showing from a slightly different angle something that you may not even know about. Again, what I'm talking about here is not necessarily the person consuming that. So for those of you who saw part 2, I tried to illustrate here with that example that I gave from the film Contagion, that the people who were affected weren't actually the people eating that pig. It was the chef and the woman who shook hands with the chef. Similarly here, it's been long known that cancer is more prevalent among people who work in slaughterhouses, who work in the meat industry, butchers at grocery stores. There's a lot of studies there illustrating this. And so again, I'm trying to raise this issue because usually the people that get the brunt end of all this are low-paying folks who aren't necessarily able to change their job. They're not in the same position that many of us are in. Our choices, particularly around animal products and meat, affects them very, very profoundly. This is a really interesting individual. His name is Harold Hausen. He won the Nobel Prize in medicine a few years ago. He discovered the connection between cervical cancer and human papillomavirus, or HPV. And in fact, now there's a vaccine against HPV that has dramatically reduced the incidence of cervical cancer. Well, he turned his interest later on in life to look at this phenomenon that is happening all over the world, where we're seeing many new forms of cancer come in, particularly into the young. There's all these cancers of people, particularly gastrointestinal, people dying in their 30s and 40s for unexplained reasons. We don't know why people in their 30s should die. Some of you will know the name Nabeel Qureshi, a pretty well-known speaker there, who died in his 30s. He was a physician who died in his 30s of stomach cancer. And again, these are not normal, and we don't know exactly why he died, but Zerhausen has been investigating that, and he has indeed found and published, here's some of his articles, that in fact, the animal supply chain is filled with these infectious agents that tend to cause cancer there, which affects many different stages along that supply chain. This comes from a wide variety of factors, but I can tell you that the most of it is that we're cramming in animals into very small spaces, not handling them rightly, putting them on bizarre diets that they were never designed to eat. And we as humanity now are reaping the consequences of this. This is quite serious here. So in conclusion, we need to drop the hammer on this disease by complying with the government's recommendations. Short-term pain is long-term gain for both lives and the economy. If we're in this no man's land of kind of trying to do social distancing, kind of not, it just makes it bad for everybody, where the economy is shut down, but we're not really moving the ball forward in any meaningful way. As a society, we need to take this seriously to rapidly overcome this. We need to change our cultural norms. And I think that masks should be implemented to drop the transmission rate. And again, my prediction is that this is going to go widespread in the next few weeks. Social distancing does not mean social disengagement. I wish I had more time to elaborate on this, but this is an opportunity to get closer to people starting at home. To those who are outside your home, write letters, do video calls, and reach out. This is an incredibly important time for us to remember that we are humans that need connection with one another. Let's think about root causes, particularly with the supply chain, to try to build a movement. I'm going to hopefully get to touch on this in later calls, hopefully the next call, on why we need to think about the supply chain and how capitalism run amok. I believe in capitalism, but when it's run amok and it just cares about the lowest price goods, whether it's low quality products from China or other countries, we are fostering a system here that is going to bite us back. Otherwise, there's going to be another serious epidemic in a few years. And I'm not going to scare anybody, but I think there's other viruses that could do far worse than SARS-CoV-2. And we need to remember and serve the poor in these difficult times. My wife was reading an article last night about a woman in Nigeria who heard the recommendations about hand washing and soap. Well, she didn't have money to go buy soap, and certainly not access to clean water. And she said, if I do that, I can't feed my family. What am I supposed to do? These viruses and these kinds of things always hit the poor the hardest. It's extremely tragic. Most of us don't have to think twice about washing our hands here. We need to think creatively about how to serve the poor in these very difficult times. All right, with that, I'm going to transition over to Dolores Bamford. So some of you know her, some of you may not. She's a portfolio manager here at Eventide. She's an incredible person who manages 3 of our funds. She did her undergraduate studies at Wellesley, did her master's degree in finance at MIT Sloan School, and then she was at Goldman Sachs for a number of years, where she was very involved in their ESG implementations into their assets they manage there. went to seminary and got her master's degree from Gordon Conwell, and then wanted to come back into finance, and we're very pleased and honored to have her here at Eventide here. So she's going to have a couple slides here, and then we're going to do Q&A and hopefully wrap up around 3:45, 3:50 or so. So with that, I'm going to hand it over to Loris.
Thanks, Finny. Can you hear me?
Can hear you well.
Oh, great. Yeah, I'm just going to go over a little bit of the health and economic impacts of the virus and provide some perspective on the markets, and hopefully then we can go to Q&A. For the first slide, as Finny had shared, the toll on America from this virus is unimaginable, almost unspeakable to me, horrifying the cases are, the death rate. We're at a point now where 1,000 people are dying from the virus a day in the US and more globally. So, I really agree with Finny how important it is to implement strict action so that we can change the effect of the rate of the deaths going forward from this virus. And hopefully in a couple of months, we can see, positive effects from this, at least it's slowing the rate of the number of cases and deaths. On the next slide. But the strict actions are causing, a significant impact on the economy. As you've seen in the news, we're having a massive increase in unemployment right now as business shut down in this era where we have to social distance and work from home and not go shopping and not go to restaurants. And so that's obviously having a huge impact on the economy. Just recently, I think it's as of today, 6 million Americans saw unemployment. So that's a 3,000% increase. So the effect on the economy is massive. Next slide. There's also sort of, as Finny was saying, there's sort of, significant emotional, I would say psychological and a cultural impact on society self-isolating. We're seeing weddings having to be canceled, various school and important gatherings being canceled, and even more troubling, people not even be able to plan or attend funerals right now. So there's just massive disruptions occurring. So next slide. And then on the economy, the contraction for the second quarter related to the social distancing and the virus is going to be substantial. Goldman Sachs now is projecting, a 34% contraction in the second quarter and up to 15% unemployment. And the Dow, as we've seen so far, is I think from peak to trough this quarter has declined at least 35%. It's on a somewhat recovering path at this time, but it's in bear market territory. The government is coming to the rescue with trillions of dollars of stimulus, and the Federal Reserve as well is doing everything it can in its capacity to keep the financial markets working well and in buying bonds and filling the gap right now that we have from what the social distancing and the virus is causing. So a lot of good news there from the government and the fiscal actions and the monetary actions being taken. So on the next slide, I just thought this would be really important to talk to you about perspective. Even though it's difficult right now, given so much suffering and need that we're seeing in the world from the virus, I think it's really critical right now to have perspective. And in addition to perspective, to have patience and a long-term orientation and a disciplined process for investing. I've been a portfolio manager for 25 years, and I've managed assets through the oil crash of 98, the tech bubble of 2000, the 9/11, 2001, as well as the great financial crisis in 2008. And I can show you, as I show you here in this chart about bear markets, is that the market will recover from this. there are many types of bear markets, and if I shared with you my experience from each of the ones that I've been through, I can share with you that all of them look like what we're seeing today. Actually, I think today is kind of a combination of a few trends in terms of 9/11, as well as the great financial crisis. And these bear markets take different times to recover, but in the end, they all do recover. And for event-driven one, it can be shorter, cyclical can be longer, and something more structural can be even longer than that. But with patience and discipline, we will recover. And what's important for us is that we're focused on downside protection right now, and resilient companies that are extremely strong and be able to weather the downturn. So the next page, you can see that this is a reflection of all the bear markets over time. I think Goldman Sachs had one, and this is from our own paper of bear markets, that bear markets have happened every 5 or 10 years or so in the history of America. In this case, I think we go back to 1937. But it's not unusual to have bear markets. And, if we can allow ourselves, we can see that the bear markets are actually an opportunity to be buying equities in the market. And you can see over time, too, the market, even through the bear market trends, is upward sloping. And in my opinion, this really reflects really the strength of the U.S. economy. So this is the S&P 500. So I'm going to just focus on the U.S. at this point. But I really think this reflects the strength of the U.S. economy over time, and its know-how and ingenuity, its entrepreneurialism, and its focus on innovation that continues to drive it. I think you can see surveys that show that the trends over time, if you take a very long time trend over equities, the returns have been at least 6 or 7% a year. So we can look at this time, as a time of a lot of stress and fear, but we also can look at it as a time for opportunity to invest in companies that we really think are making a big difference. And we can go over some things in Q&A as well, but I want to share with you on the next page just a word of encouragement as well. This verse, Joshua 1:9, I feel has always been something important to me that's helped me through crises and difficult times and in difficult markets as well. This verse is sometimes called the New Leaders Commission or Encouragement, and this was what the Lord had spoken to Joshua upon Moses' death, and when the days of weeping and mourning ended, and when Joshua took the reins over to lead the Israelites into the promised land, that the Lord spoke to him and said, "Be strong and courageous. Do not be frightened or do not be dismayed, for the Lord your God is with you wherever you go." And I just would like to use this verse as an encouragement to everyone on the line to be strong, and that we will get through this. And as Finny says, that tough actions are needed, but this will definitely improve the U.S. economy and the healthcare system longer term. And the U.S. economy will recover. And here at Eventide, we'll remain focused, on investing for the long term and in companies that are creating value for the common good. And we will remain focused on protecting our clients' assets as well as investing that will make the world rejoice. So I'll turn it back to the moderator for questions.
Thank you, Dolores and Finny. We do have a couple of questions, and we'll try to be quick in asking them, and we'll ask Dolores and Finny to be quick in their answers so we can try to wrap up here in the next couple of minutes. In surveying the questions, Finny actually answered a lot of the questions throughout his presentation regarding vaccines. But here's one specifically for Dolores. Many investors are focused on yield or income generation for their investments. So given how low interest rates are now, where do you see the most attractive places to generate yield?
Thanks for that question. I do see many places for attractive yields, but the way we invest, we don't look just for high yields. I think looking at high yield right now is incredibly dangerous because that is usually in sectors that are very cyclical where you could see the dividend being cut. And I think if you notice some of the news right now, many companies that are in more cyclical sectors are having to cut their dividends, particularly like in the energy sector. So for us, in looking for places for yield, we are looking for companies that have really strong prospects for attractive risk-adjusted returns. And in the way that we do that, we are looking for companies that have high-quality managements. The companies are well-positioned in their industries that are growing, that they have strong business 360 alignment, or doing well to their stakeholders and for the common good, and that have really strong financials, balance sheet, and cash flow, and they have business models that are very resilient so that they can pay their dividends and grow their dividends. That's what's critical, is that the companies that we invest in have the financial ability to hold and grow their dividends. And so right now we're seeing in the market, there are a lot of opportunities, as I said to you, because many stocks are down 20, 30, 50%. And the opportunities lie in clean energy, technology, healthcare, staples. We love the utility space and in some selective aspects of REITs as well. So I think the opportunities are prevalent right now. Even in the bond market, with the pullback in some of the investment grade bonds, we're seeing attractive yields emerge there.
That's great. Thank you, Dolores. We'll have one more final question. This one's for Finny, and then we'll wrap up after this. Finny, can you speak to any big themes in technology and biotechnology that might be reinforced or be emerging from this pandemic?
Yeah, there's a lot of great questions. I wish we could spend more time doing Q&A, but I understand our call is restricted here. So yeah, in biotech, there's a lot of great themes here that are emerging. So one of the first interesting themes that is emerging, and this is obvious, you might think, but it's also not obvious at another level. So in general, we have way underinvested in anti-infectives. So that doesn't just include viruses, but it includes bacteria as well. And so you hear these different reports of flesh-eating bacteria and Acinetobacter, things like that, of people coming back, and there's just nothing for them. One of the great competitions that we're in right now is man versus bugs. And I actually think that this is one of the great threats that you don't hear debated on presidential debates or things like that we ought to be really careful to not underinvest into, particularly as we move into times of more globalization and times of increasing transportation and connectedness. So we need to change the way that reimbursement happens. There's a reason that companies don't pursue the whole world of anti-infectives. Immunology, we still don't understand the immune system. Even right now, a lot of the reasons that people are dying from coronavirus is not because of the virus itself. It was the trigger, but they get an over-exuberant immune response, which then causes complications, particularly in the lungs, as their lungs become inflamed and they lose their ability to oxygenate properly. And so there's a lot of great work we've got to do left on understanding the immune system and modulating its reactivity. The whole world of diagnostics, I mean, this is obvious, again, at some level, but why were we slow out of the gates in getting testing ramped up? And we're still really not there yet. Why can't we have a simple test? I mean, this is actually something that we could do today if we had the will to do there. But when you go into your doctor's office, they do a swab and they tell you all the viruses. They just do DNA sequencing and they say, you've got these 2 viruses, 3 viruses. These ones are pathologic. These ones are not. We need to get to a point where we can systematically do that, and marrying that to tech as well. When we think about some of the ways that in Singapore and South Korea, where patients nationally are being SMS'd, they're using geolocation and other tools to ensure that their disease is not being spread. I think there's a really interesting area where tech and biotech are going to intersect. There's all these great themes that we don't have time to talk about today about the cloud, collaboration, automation. There's a lot of great themes here, but I really think we're entering into a new phase of investing. This is going to be the post-coronavirus shock that sobers us up, and I think causes us to rethink many of these themes and hopefully invest more appropriately for the future.
That's great. Thank you, Finny. We'll go ahead and wrap up our call there. We do have another webinar scheduled for next Thursday, the Timeless Truths for Investing. It'll be presented by one of our co-founders, Jason Meyer. It'll be next Thursday, April 9th at 3 p.m. Eastern Time. You'll be able to register at the URL there on your screen for resources, go.eventideinvestments.com/COVID-19. Also, Dolores referenced 2 charts regarding bear markets on her slide presentation. We actually received a lot of questions regarding those. Those charts are found within a white paper on that same resources page. So go to that resources page, go.eventideinvestments.com/COVID-19 for any kind of follow-up from this call today. Thank you. That concludes our call. You may now sign off.